I would begin with my 8 pre-procedural steps and then take vital signs, which I've already done both. Next, we're going to go into our general survey and our drill notes. Patient appears well dressed, appropriate for the weather. He's not in distress. He's calm and collected. Mood is good. What would you do in the case of a fire?
Run.
Who's the President of the United States?
Donald Trump.
Where are you currently?
Estill Springs, Tennessee.
What time of day is it?
Afternoon.
When's your birthday?
1996.
Can you repeat this phrase after me? All dogs go to heaven.
All dogs go to heaven.
And what was the weather like yesterday?
Hot and humid.
My patient spoke with a regular rate and rhythm. He responded appropriately to to my voice, and he demonstrated new learning by repeating my phrase. Next, we're going to go into our optic nerves. I'm going to start with my olfactory. If you can plug one nostril and close your eyes. Tell me what you smell.
Mint.
All right, we're going to do this bilaterally. Next, we're going to go into our optic nerves. Stare straight ahead for me. I'm going to shine a light in your eyes. Pupils react equal and reactive and accommodate consensually to light. Reflex is intact. Next, we're going to go into our abducens, oculomotor, and trochlear nerves. You can stare straight ahead, and you can use your eyes. You can follow my finger. All right, upon the completion of 6 cardinal basements, there's no uncontrolled repetitive movement. Next, we're going to go into our trigeminal nerve. You can clench your jaw for me. And then open and close your mouth. Jaw moves slowly, and there is no crepitus. So that is intact. Next, we're going to our facial nerve. You can raise your eyebrows for me, show your teeth, and smile. Facial nerve is intact. Next, we're going to go into our acoustic nerve. You can put your hand over one ear and repeat the phrase I whisper to you.
ABC.
Good. This would be done bilaterally as well. Next, we're going to go into our glossopharyngeal and our vagus nerve. You can open your mouth and say ah.
Ah.
All right, there's the rise and fall of the soft palate, and the uvula is midline as well as the tongue. Next, we're going to go into our spinal accessory nerve. If you can raise your shoulders for me, don't let me push down. Good, that is intact. And finally, our hypoglossal. You can stick your tongue out and down for me, stick it up, stick it side to side. All right, can you say light, tight, dynamite?
Light, tight, dynamite.
All right. You had no problem saying that, and there's no repetition of the tongue, so that is intact. Next, we're going into our skin. Skin, upon inspection, is there's no erythema, no lesions, no scars, and it's intact. It is appropriate for race and ethnicity. Upon palpation, it is warm to the touch. Turgor turns to baseline in 1 to 2 seconds. It is smooth. There is no masses or lesions. Put that down. Next, we're going to our head and face. Head is normocephalic and smooth contour. Face is appropriately aligned and to the head, and the head is appropriately aligned to the body. I'm going to test your Lacro apparatus. Touch. All right, there's no drainage. I touch that, and there's no tenderness. Now, let's move into the hair, scalp, and nails. The hair is evenly distributed and smooth texture. There's no excessive oiliness or dryness, and it's thick. Scalp is intact with no lesions, masses, erythema, or vermin. Next, we'll move into the nails. The nail itself is translucent. The nail bed is pink. Capillary refill is in less than 2 seconds. Texture is moderately thick. You can take your 2 index fingers and put them together. Create a diamond. There is no clubbing. Thank you. You can return those. All right, and next we're going to move into our eyes, ears, nose, and throat. Upon inspection, eyes are symmetric and appropriately aligned to the face. Sclera is white. You can pull down your eyelids for me. The conjunctiva is pink. Okay, you stop. There's no erythema or edema. And the eyes are not bulging in any way. Next, we're going to move on to the ears. Ears are, skin is intact. There's no erythema, edema, or swelling. There's no tenderness upon palpation. When using an otoscope, I would pull an adult ear back, up and back, and a child's down. The bony structures are intact. Tympanic membrane is pearly gray and white. Pink pearly gray. Sorry. There is on the right side, the conal line is at 5 o'clock, and on the left side, the conal line is at 7. There's no cerebrum or excess debris. Next, we're going to go into our nose. Nose is symmetric. There's no septal deviation. Nares are patent. You can lift your head for me. Mucosa is pink and moist. All right, you can relax. Next, we're going to move into our throat. If you can open your mouth for me. Tongue, gingiva, mouth, and mucosa are all pink and moist. Uvula is midline, tongue is midline as well. Next, there's no masses or lesions. Next, we're moving to the neck. The neck is symmetric. There's not any erythema, lesions, or scarring. Upon palpation, the trachea is easily displaced, and the thyroid is not palpable. I'm going to move into my my lymph nodes. So I'm going to start with preauricular, postauricular, occipital, posterior cervical, submental, submandibular, jugular digastric, deep cervical shape, and supraclavicular. All the lymph nodes are non-palpable and are not swollen. Next, we're going to move into our respiratory assessment. If you don't mind standing and turning around for me. Upon inspection, it's neck is symmetric. There's no scarring, masses, or lesions. No erythema or edema. Upon palpation, I do not feel any masses or lesions. Alright. Next, I'm into requests. There's no hyperresonance. If you can breathe in and out for me. One more time. My hands moved equally upward, so the tactile firmness is intact. Next, we're gonna auscultate the lungs, the lobes of the lung. On the right side, there's an upper, middle, and lower lobe. On the left side, there's an superior and inferior lobe due to the placement of the heart. I'm going to listen and for a full inhale and exhale for each spot on the back. Lung sounds are normal and adventitious. Next, we're going to move on to our cardiovascular assessment. If you can stand up and turn around for me. Oh, I'm sorry. The posterior and anterior is 2 times that of the lateral. Sorry, make use of it. Okay. For our cardiovascular, the heart, the anterior side is on the right side, and the posterior side is on the left side of the chest. The chest appears symmetric. There's no scars or lesions. There's no erythema or edema. There's no pitting as I palpate. There's no masses or nodules. The apex of the heart is at the 5th intercostal space at the mid-clavicular line, and the base of the heart is at the right sternal border. Sorry, excuse me. Next, I'm going to auscultate. The S1 valve is the closing of the AV valve, and the S2 valve is the closing of S2 sound. Sorry, is the closing of the semilunar valve. All heart sounds were regular in rhythm and rate. There was no abnormal sounds. On the lung sound, there was no rhonchi, whales, or rails, or abnormal sounds there. Next, I'm going to move on to our neurovascular. Oh, sorry, I need to do the pulses. So I'm going to do your pulse. First, carotid. You okay?
Okay, keep
Okay.
going.
Next is the brachial, radial, the femoral myself, popliteal behind the knee, dorsalis pedis at the top of the foot, and posterior tibialis is at the back of the foot. Pulses are all at a 2 plus. Do you have any any pain, numbness, or tingling?
No.
Okay. And his he has not had any pallor. His color has been pink throughout. Next, we're going to go on to abdominal assessment. Ideally, I'd have my patient laying down, knees bent up, and provide some form of privacy. I'm going to start with auscultation to not activate any false vowel sounds. And we're going to start in the right lower quadrant because that's where the vowels start. Move right upper quadrant, left upper quadrant, and left lower finally, following the track of the vowels. Each of these we listen to a full 5 minutes, and normal active vowel sounds are between 10 to 30 per minute. Next, I'm going to palpate the bowel. Palpate the abdomen. I do not feel any masses or lesions. Also, during inspection, there was no erythema, edema, scarring, or anything like that. He has not had any tenderness as I progressed, or as I palpated. Next, I'm going to move into percussion. All right. There was no, it was tympanic, no hyperresonance with percussion. And you can stand up for me. I'm going to do postervertebral and turn. All right, next I'm going to test tenderness, postervertebral. Any tenderness, any pain?
No.
All right, thank you. You'll sit down. Okay, next we're going to move into our musculoskeletal system. We're going to start with our joints. You could look down at the floor for me, up at the ceiling, and we're going to circumvent, so we're going to turn our head in a circle. Good. You can relax. Don't let me push against your head. Good. Next, we're going to use your arm. You can abduct away from the body, adduct towards the body, and then we're going to subduct in a circle. Good. You can keep your arm up for me. Don't let me push up. Don't let me pull down. Good. Next, we're going to do our wrist. If you can flex down towards the floor for me, flex up towards the ceiling, we're going to circumduct. Good. Next, you can stand up for me. All right. Posture is erect and steady. Excuse me. Can you bend over and touch the floor and lean back up? I'm gonna keep my hand on your spine. All right, lean back up. Spine is intact, no curvature, so there's no scoliosis. You don't want to walk towards the stone for me. I'm walking back. Gait is steady and regular, and no trouble walking. Right. Next, we're going to go into our neurological assessment. I want you to tell me if you feel sharp or dull pain. Okay?
Yeah. Sharp. Dull.
All right. I'm going to touch your cheek. Let me know if you can feel it.
I can feel it.
Okay. Next, we're going to test our grip strength. I'm going to give you my fingers. If you can grab them and squeeze at the same time. All right. Those are equal bilaterally. Next, we're going to do our repetitive movements. So we're going to go fingers to thumbs. Good. And then if you can touch your fingers to your nose twice. Good. Coordination is intact. Next, we're going to do our plantar and patella reflexes. So I'm going to strike your patella with my hand. Okay. All right, and that's intact. And next, we're going to do our plantar reflex, which is we're testing for the Babinski sign. And his is negative as his toes curl downwards. A positive would be up and out like an infant. And then I would conclude with my 6 post-procedural steps.